Hi everyone, my name is Anna Kemp and I am an honors nursing student at UMass Amherst. I'm also a member of the Beta Zeta chapter of Sigma, so I'm very excited to be part of this virtual symposium. My honors thesis topic focuses on neonatal breastfeeding outcomes. I've had the opportunity to work with Dr. Carrie Ellen Briere and Tegamea Mulingo from the College of Nursing on this project. Both faculties specialize in maternal health, and Dr. Briere is also a certified lactation consultant. Specifically, I am interested in mothers' experiences of breastfeeding throughout the transition from NICU to home. So, the evidence shows that direct breastfeeding provides optimal nutrition for newborns, especially those that are underdeveloped. When neonates feed directly at the breast, mothers are able to better control milk flow and supply. Neonates can maintain a stable respiratory status while feeding compared to bottle feeding practices. Further, babies that direct breastfeed receive maximum health benefits from breast milk. In general, mothers are faced with many challenges associated with breastfeeding that become further complicated with neonates. Proper education and support in a controlled environment, such as the neonatal intensive care unit, allows mothers to develop a thorough understanding of breastfeeding and strategies for optimal outcomes. However, barriers in the home environment, post discharge from the hospital, lead to inconsistent breastfeeding practices. In fact, there is a 59.5% decrease in exclusive breastfeeding practices at discharge, compared with term infants. Direct breastfeeding is challenging for late preterm infants as well as very low birth weight infants. Since it is not until the 32-week mark that the gag reflex emerges, neonates lack the maturity of full-term infants. Premature babies have difficulty with the coordination to suck, swallow, and breathe simultaneously while feeding directly at the breast. Neonates are unable to respond to sleep-wake cycles that control feeding cues, leading to disturbed connecting with caregivers. The NICU environment is complex and intimidating to parents who feel like observers in their baby's care. Feeling like an outsider can decrease motivation to participate in breastfeeding. Post-discharge, parents often feel unfamiliar with guidelines about optimal age and weight of infants for breastfeeding, how to know infants are getting sufficient milk, how to improve latch, how to increase milk supply, the list goes on. The literature shows that these concerns cause parents to switch to bottle feeding and formula supplementation. It's important to note that some women are not able to breastfeed due to medications and medical history, while others find the societal pressure to breastfeed anxiety-provoking. The purpose of this proposed study is to measure the impact of breastfeeding support in the NICU by certified lactation consultants on mothers' use of direct breastfeeding both in the NICU and post-NICU discharge. We propose to investigate the benefits of encouraging first oral feeds at the breast and implementing NICU certified lactation consultants in order to achieve increased occurrence of direct breastfeeding post-discharge from the NICU. This study is a qualitative secondary analysis of a sample of 470 NICU responses derived from a national survey of 3,500 mothers. The survey is titled Human Milk at Home, the Reality of Breastfeeding and Providing Expressed Milk. This survey addresses mothers' experience with breastfeeding in the NICU and the home environment. 30 questions assess participants' knowledge of breastfeeding practices, and 6 questions refer to their experience of breastfeeding support after birth. Ultimately, I plan to analyze pre-existing survey responses to examine the impact of NICU lactation support and encouragement of first oral feedings at the breast. 14 sources were examined in my literature review. The search engines used were CINAHL and PubMed, and only articles published within 10 years were analyzed. Sources were limited to 2 patient populations, including mothers with newborns less than 1 month and infants 1 month to 23 months. The survey analysis is still in progress. I expect that responses will describe the association between lactation support in the NICU and continued breastfeeding practices in the home. My conclusions will be available in the form of a manuscript come December. We hope that research findings inspire change in nursing interventions in order to promote successful breastfeeding outcomes among mothers and neonates after discharge from the NICU. That's all. If you have any questions, please feel free to reach out to me. My email is akemp, akemp @umass.edu. Thanks, everyone.